On September 19th, the World Health Organization released their first ever global report on hypertension. That report revealed that 1 in 3 adults worldwide has hypertension, and that 80% of those diagnosed with it do not receive adequate treatment for it. Nation News spoke to Dr. Kenneth Connell, the Vice President of Healthy Caribbean Coalition, to discuss what this report means for Barbados.
How well are we doing as a country in terms of our own data? So I'll go to the fact sheet. And I said it's a schematic showing various conditions or projections. If we continue as it is, our control rate will be 34%. So only 1 out of 3 people with hypertension will be controlled. Of course, only 2/3 of those individuals who have hypertension will be treated. And not all of them will even know that they have it. So people always get confused. How could you have hypertension and not know you have it? We know from population modeling and data that only 70% of people living with hypertension in this country actually know that they have it, which means there's about a 30% of people out there who don't even know that they have it. How do you know that you have it? It's not a sophisticated test like having a colonoscopy, or even if you're afraid of needles, having a blood test. It's simply putting a cuff on your arm and having your blood pressure checked under certain conditions and making the diagnosis. So these are things that are important. I guess the next question is, well, 34% doesn't sound that bad. How are the other Caribbean countries doing? Well, control rates in Jamaica, for instance, are at about 19%. Control rates in our closer neighbor, Trinidad and Tobago, it's at 21%. In the United Kingdom, however, the control rate is 30% as well. So it's not to say that larger countries are doing fantastic. So Barbados isn't doing too badly when you compare to some of the other Caribbean countries, and even one larger country that I have just cited. But here are some other facts about as reported by WHO. Now, there are certain national responses that are all assessed in each page of each country page. There's a national target for blood pressure, and yes, there is. Barbados has one. There's a national target for salt consumption, and yes, this is also being ticked off by the WHO. Is there surveillance in terms of conducting recent national measurement of blood pressure or hypertension? No. Was there conducted recently a national survey on salt or sodium consumption? No. The last Barbados salt study was a few years ago, right? And then functioning system for generating reliable case-specific mortality data on a routine basis? No. And finally, guidelines for the management of hypertension. You could argue this is an unfair metric if we are using the HEARTS guidelines. And we also have regional guidelines such as produced by CARFA. So we will, for instance, produce a Barbados hypertension guidelines, but it doesn't mean that we're not following guidelines. Of course, the WHO themselves have produced international guidelines which are identical or structured around the HEARTS model. So those are the profiles, and I guess finally I'm going to go into how do we address these things. I have already hinted to a lot of it. One is structured population-based interventions, such as population measures to reduce sodium consumption. This is largely with interventions such as public education, as well as warning labels so that people know when foods are high in sodium. There are also other interventions such as the adoption of various fiscal measures to reduce consumptions of sugary drinks and addressing things like childhood obesity. And finally, having a structured approach to the management. And this is the HEARTS package that I was speaking of. Having that implemented throughout every polyclinic, in the hospital, and private doctor, so that we literally are all singing from the same hymn sheet.
Okay. How difficult would it be to implement these solutions?
Well, the fact that 42 countries have already begun the scaling up process or have scaled up suggests that the program is built such that it's scalable, right? It wasn't meant to be a research project. So far, I believe that the Hearts program is present in only just about four of our primary care sites. So we do need to scale up and scale up quickly.